Hi everyone. I'm Ruth Stross, Head of Nursing with Neurology Academy, and I'm here today with Gilly Burden to chat about her role and the work that she does. Over to you, Gilly. It'd just be great to know a little bit about you, your role, and where you work.
Okay, thank you so much for inviting me this morning. So, I am the team lead for the community neuro team at Wye Valley NHS Trust. So, we support the county of Herefordshire, famous for the Herefordshire cow and cider, and it's a big rural farming county. So, we do a lot of travelling. And my team, there are four of us, and we currently support people with Parkinson's, multiple sclerosis, and motor neurone disease. We link in really strongly with our local hospice and the OT that works there, which works really effectively. And the kind of support that we're offering people can be anything from fatigue management education to looking at 24-hour positioning to looking at helping people to remain in work, feeding, writing, computer access. So it's kind of everything. Um, and we are really lucky to be able to kind of be out with people in their home environments as well as bringing people into clinics. And part of our work is also done virtually as well. So, yeah, it works really well.
Thank you. Thanks, Gilly. It's fascinating the role of the OT. I think it's incredibly complex, and I just wonder how what your team and what your kind of experiences around supporting patients from diagnosis with kind of long-term conditions from diagnosis through to end-of-life care. And what does that look like for someone with a neurological condition? And in your experience, what kind of feedback have you had about how important it is?
Yeah, absolutely. So we are really lucky. We do see people from the point of diagnosis right through to end of life, and I think that's really powerful for our clients because we build up that kind of rapport with them and that trust really. So I think we are very honoured to have people that are very open and transparent with us in terms of their adjustment to kind of getting their head around having a long term condition. Um, but also, as that condition progresses as well, and perhaps their needs become, we're more involved with them. Um, Having that baseline relationship that's been building over years, I think is really important. So we're very lucky. We have a very strong multidisciplinary team working within the neuro team. So in terms of the neurophysios, the specialist nurses, the local hospice, so the palliative care consultants, speech and language therapists, the dietitian. So we all work very closely together. We'll often do joint visits, which I think can be really effective. Um, but when we first meet somebody at the point of diagnosis, I guess our goal is to support them in terms of getting their head around coming to terms with having that diagnosis, but also from an early point, we're teaching them about their condition and strategies and what they can be doing to be the healthiest and the fittest in terms of living with that condition. And I think that is is so important because we're educating them to be able to self-manage. So they will tap into us when they need to, but we will often perhaps not see them for perhaps a couple of years because things are going really well for them, but they know that if anything starts to change they can come back to us, and it's going to be that same person.
Yeah, it's amazing, isn't it? I guess for OT, World OT Day, the kind of theme at the moment is occupational therapy in action, which is what you were beautifully describing just then. What does that mean to you personally, and kind of how do you see it in your day-to-day work?
Well, I think what the theme's doing is it's kind of highlighting kind of the active efforts of OTs across the world to try and get people to be engaging in meaningful activities and participation. And that's the whole emphasis of OT. I think a lot of people out there, if you did a survey and asked them about what is an occupational therapist, if they haven't come across one, actually, I don't think they'd be able to answer it very accurately. And I think our whole philosophy is looking at keeping people doing the things that they enjoy doing, that are important to them, that are meaningful, and whether that is rehabbing them so they are able to regain lost function, or whether it's looking at how somebody can do the same task but perhaps in a different way, because we're not going to get them back up to their previous baseline. Um, and the fact that although we're working with progressive neurological conditions, so things are going to change for people, and it's about supporting them to, instead of them feeling that they are, they're lost, that they are actually, the meaningful things have gone. Actually, it's just doing things in a different way, um, and I think
Yeah.
we're hopefully able to do that with people.
Yeah, absolutely. I mean, that leads beautifully into the next question, which is around the area that I know you've done a huge amount of work, lots of experience. Vocational rehabilitation. I think it's key to all parts of neurology at the moment is keeping people in work, and as you just described, modifiable um, kind of areas. What do you, what can you tell us what that involves, and kind of why does it matter so much to the people with MS and with people
Yeah,
with long-term
so
neurological conditions?
vocational rehab, so supporting people to remain in work or to regain work, or looking at how that someone, if they are unable to continue working, how they leave work well. It's a real passion of mine. I've been very lucky. I have done my MSc in vocational rehab, and I have been able to introduce a service into our team, and I have done that not by gaining monies from the CCG for specific service. I've brought that into the service because actually, work is an occupation, and and I feel that it's important that we're able to offer a service, as well as looking at fatigue management and computer work and positioning, that actually work is at the forefront as well. So people leave work early with neurological conditions, we know that, and the reason for that is multifactorial. There's lots of reasons why, um, whether that's just in terms of their symptom management, whether that's due to kind of breakdown in communications, their work environment. It's really complex, but what we try and do is to make sure that from the point of diagnosis, when we're meeting our patients, that they're aware that there is support with remaining in work, and whether that is just as much as a sentence, is as far as it goes with me saying, how is work, are you coping, do you feel that everything's okay? Yeah. And and me saying, if anything changes, don't sit on it, come to us, talk to your specialist nurse, email the team directly, give us a ring, because what we want to try and do is avoid that crisis situation. Um, and actually, for our team, that's very much our mantra. If we can, prevention, it's sowing the seed of change from an early point. And what we want to try and avoid is for any client or patient to be reaching the point of crisis, whether that's in work or whether that's in the home environment. So keeping someone in work, there are some really simple adjustments that can be made. And it's making sure that people are aware of their rights, the Equality Act, and making sure that they're aware that adjustments don't have to be expensive, and that they have a right to have adjustments in the workplace. And it's often just giving people the confidence and the knowledge to go forwards with that. Sometimes that's as little as we do.
Yeah, it's amazing. I mean, my next question is around the kind of how you work within the multidisciplinary team. And from my experience as a nurse, I've worked in the neuro rehab team, and I've across two services, I've learned so much from the OTs that I've worked with. We've gone on joint visits into the workplace and been able to really support people. So how important is that for you to be collaborating and contributing within that wider neurology MDT?
Yeah, absolutely. And I think, it's that team approach is absolutely key to um, enabling someone's kind of journey to be that smooth transition. And in that workplace, I mean, I've had somebody recently where um, it's surprising how you will come back into somebody's kind of work life to support them. It's not just a one-off thing, that actually as things change, or often it will be as their line managers change, that we need to get back involved again to do that education. So we'll often do work visits and meet with the employer. um, However, often it's just a case of us, providing a supporting letter which has got, information about the person's condition. So, it's really kind of explaining it and how it's individual to that client and their symptoms, talking about kind of their work role, adjustments in place, and then, that might already be in place, and then saying, but actually, if we do, A, B, and C, actually that would make a huge difference to them in terms of kind of optimizing their performance at work. And I think it's just changing the stance from being for that kind of client feeling almost apologetic for having a condition and the impact it's having on work, to actually, no, I do have a condition, and if we do A, B, and C, I know that I can work better, longer, more effectively for you. um, and actually it's changing, it's giving that person the confidence to be, you know kind of standing up for themselves, from a work capacity.
Yeah, and I mean, just out of interest, do you have like feedback that you've had from patients? Because I know how overwhelming it is when people are trying to modify their workplace, when people are trying to negotiate with their employers and they're trying to deal with colleagues who maybe are not understanding their condition. I mean, what feedback have you had kind of from that work that you were describing?
I mean, I think what we have a lot of patients who are really thankful for our involvement, and they would say they wouldn't be in work still if it wasn't for us. Kind of, and I think, we run alongside. We do not replace occupational health. They are there in their own right, and every person should be able to have access to occupational health. But I think because we come from a health perspective, and we really know the condition inside and out and how it's impacting. And when we do, we are lucky enough to spend, you know, hours with these patients, in totaling, compared to a half an hour telephone occupational health assessment. So we do know these people inside and out. But I've had somebody who I've spoken to from an initial assessment who said, who's been a teacher, and they're on their summer holidays. They're already been on sick for a while, and that it's now in the holiday time, and they're saying, there is no way you're getting me back to work in September. I'm not going. And they've gone back to work in September, and they're still in work. And it's been, and they are saying, if it hadn't have been for you, I would have left. And I wouldn't have retired medically, I would have left. I would have quit because things were so horrendous. So I think we just provide that knowledge and support that people need, because it's about choices, and it's about having the choices to make the right decisions for them. I think that's the key.
Yeah, I mean, that's incredibly powerful what you just said, the impact on the person, on the services, on the NHS, on everything, but predominantly just keeping people in work. I mean, looking ahead, what message would you like to share with other occupational therapists, with nurses, with the wider MDT about kind of how important it is for us to celebrate World OT Day and the amazing OTs that we work with?
Well, I would say that OTs love to work collaboratively. We are, we obviously work autonomously and we can be out there on our own. But that MDT working is so powerful. So having those regular kind of multidisciplinary team meetings where you're bringing your complex patients for discussion, doing those joint visits and kind of sharing those different perspectives, which are really unique to all our different professions, can be so powerful. And at the end of the day, it's keeping that client, that patient, they are the center focus, aren't they? And it's enabling them to have the right information to make the right choices for them at the right time, that it's needed.
Yeah, absolutely. Thanks, Gilly. And just for me to say, thank you so much for doing this today. I know that we're going to put a link to the OT talk that you're going to be doing. We'll also have a link to the kind of wider parts of the role that the OT has. And just want to say thank you for joining us today for World OT Day. Thanks,
Ah,
Gilly.
it's a pleasure. Thank you for inviting me.